We could do so much more to help people live longer, healthier, more productive lives. Tobacco remains the leading preventable cause of death in this country. It still kills more than 1,000 Americans every day. And yet, if you look at the communities that have done the right things, they've driven rates way down by 20, 30%, teen smoking rates down by 50% or more. We could drive those numbers down dramatically if we focus on it. Take blood pressure control. Heart attacks and strokes kill more Americans than any other cause. In fact, cause more inequalities in health than any other disease. 2 million Americans a year get a heart attack or a stroke, and yet many, maybe even most of those could be prevented by simple things like controlling your blood pressure, taking an aspirin a day if you're at risk, getting your cholesterol under control, and not smoking. And vaccine-preventable diseases are still too common. We're seeing, for example, outbreaks of measles now in communities that haven't vaccinated well. We're seeing cervical cancer that's going to continue if we don't get our HPV vaccination rates up. And we see thousands of people going to hospitals every year who don't have to if they just got a flu shot every year.
What are the big opportunities out there in health? What are the opportunities for us to not die as often or as early?
Well,
I guess we're likely to die as often.
I would start with tobacco control. You know, people sometimes think, oh, tobacco, that's yesterday's issue. It still kills more people than anything else in this country and around the world. And there's a lot more that we can do about it. It doesn't just kill people, it disables, disfigures, causes disease, it increases our healthcare costs. So tobacco is really the number one enemy of health in this country and around the world.
When you say that a lot of people think tobacco is yesterday's news, what is the next step on policy? I mean, at this point, you're dealing with taxes in New York, say, that are high enough that 1 out of 3 packs is basically smuggled into the state. So when you say there's a lot more to do, what is there more to do?
First off, there are a lot of places that haven't yet implemented the things that we know work, whether that's protecting people from secondhand smoke at work, or increasing tax, or reducing smuggling, which there are ways to do, or running hard-hitting ads, which we know make a major impact, save lives and save money. So these are some of the things that work. Healthcare system can do much better at helping people quit. Medications will double or triple the chances that you'll succeed. But really the things that are going to make the biggest impact are price, image through hard-hitting ads, and smoke-free laws.
What do you think about e-cigarettes?
E-cigarettes may help in some ways, but they are definitely harmful in many ways as well. If they get kids hooked on tobacco and nicotine, which they are doing, if they get smokers to continue smoking rather than quit, if they get smokers who quit to come back to smoking, if they re-glamorize the act of smoking or confuse smokers about what works to quit, these are all real problems with only, at this point, potential benefits from e-cigarettes.
What's your view of the evidence on whether they actually help people quit?
There's one small, well-done study. They helped a little bit. The patches helped a little bit in that study too. The two weren't statistically different. So we don't know, but we do know that people who are using e-cigarettes are not quitting at higher rates than people who aren't using them now. And as we learn more, I have no doubt that an individual here or there can be helped by them, that they might be helpful to some people. But as a societal issue, they're only going to be helpful if they're well regulated and if cigarettes are well regulated.
So I'm a dedicated reader of the CDC's Vital Signs newsletter. In the culture, when you think about drugs that are hurting people, you think about illegal drugs. When I read your newsletter, it scares the hell out of me about legal drugs. It's about tobacco, but it's about alcohol, and it's about opiates and prescription drugs, which I think there's been, according to you guys, a 400% increase in female deaths from prescription drug overdose in the last couple of years. And then also it's about antibiotics and overuse of antibiotics and the rise of superbugs. You guys have scared the hell out of me about things that are supposedly, if not safe, at least safe for adults to consume in reasonably regulated ways.
In healthcare, there's something that's sometimes called the inverse care law. People who get care the most need it the least, and vice versa. That's also sometimes true in terms of medications. We overuse a lot of medications, but we also underuse important medications. We don't get it right. One of the most striking weeks I've had as CDC director in my 5 years there was when I had, in the course of 1 week alone, looked at the increase in prescription opiate overdoses in death numbers. An increase in babies born addicted to opiates because their mother was taking an opiate during pregnancy. in distracted or drugged driving, an increase in hepatitis C from kids who started out using pills and then graduated to heroin because it was cheaper, and an increase in HIV in that same population. This is in the course of 1 week. It's every age group from babies to seniors. There are enough opiates prescribed in this country for every single adult to get 75 pills every year.
Really?
That's a huge problem. We're awash in these. And one of the things that we need to do as a society, of course, we need to improve the prescribing practices. We need to improve what states do on opiate monitoring. We need to improve what medical boards do. We need to ensure that there's a good collaboration between law enforcement for that tiny number of people who are breaking the law and treatment and public health programs to support people who need help and support. But what we also need to do is start looking at what we think about as a society, because some of the things that are going to help our health most isn't going to be taking another pill. It may be getting physical activity. It may be eating healthier. It may be joining a book club. It may be building linkages in society that are getting eroded by some of the things in our society.
This will be a really basic medical question, so forgive it, but what does it mean when an infant is born addicted to opiates?
It is horrific. Opiates change the way your body works and develop dependency or addiction. If you remove the opiates, then the opposite of what the opiate causes happens at a very high rate, and you can get a rapid heartbeat, you can get sweating, you can get profuse problems, you can get hyperactivity, and you can actually get death. Infants who are born opiate addicted need to be very carefully detoxified from that in a way that will not harm them.
I wanted to talk through for another minute the antibiotics and superbugs, because when I sit around thinking about what should I be neurotic about, that's typically what I come to. When I've spoken to some people who really study those issues, who really do work on that, they talk about what sounds like, from a medical perspective, an almost post-apocalyptic landscape where we are entering a post-antibiotic world because we're not coming up with them fast enough, and the one we have are rapidly losing their effectiveness. How worried are you, or how worried should I be, about the rise of superbugs and the sort of constricting pipeline of antibiotics, of new antibiotics?
You should be worried enough to make sure that we have the resources at CDC to reverse this problem and slow it.
I'm not, I don't think I have as much money as you think I have.
Well, first off, I'll just tell you two stories. It's not often that top scientists at CDC come to me and say, we have a problem, we need you to sound the alarm. That happened here. That happened here with a class of organisms called CRE, or carbapenem-resistant Enterobacteriaceae. They are gram-negative organisms which tend to be pretty deadly, particularly to people in hospitals. And they have developed resistance to virtually all, or in some cases, all of our antibiotics. And over the past decade, we've watched them spread, where they were just in one state, now they're in nearly every state in the US. Where they were just occasional, now there are as many as 1 in 10 of some of the deadliest organisms that spread in our hospitals. These are truly nightmare bacteria. The good news is that we know how to control them. We've now recommended that every single hospital in this country have an antibiotic stewardship program, and we'll help them to set those up. We recommend that every hospital tracks what their resistance patterns are, what their prescribing patterns are, and we're focusing on hospitals because half of all hospitalized patients get an antibiotic in their course of treatment, but maybe a third of those antibiotics are either inappropriate or unnecessary. They're given too long, they're too broad spectrum, they're not necessary. The result of that kind of problem with antibiotic prescribing is that we have more than 23,000 deaths a year from resistant organisms. And in addition to that, we have about 14,000 deaths a year from what's called C. diff, or Clostridium difficile, which is an organism you get if you take antibiotics. So it's a serious problem. We do have the risk of being in a post-antibiotic era, and I'm trained as an infectious disease physician. So I think back to my years of training and my care of patients with tuberculosis and HIV, where we had patients who we had no treatment for. And you really do feel like you're in a post-antibiotic era. You're back to doing things like removing parts of lungs and trying experimental therapies and hoping that the patient's own immune system kicks back in. But we can make a big difference. We think that with a modest investment, we'll be able to cut drug-resistant organisms, particularly CRE, by 50% in 5 years, and C. diff by 50% in 5 years. We can do this. We can make a big difference.
What about the other side of the equation? What do we need to do to reopen the new antibiotics pipeline? Because when you talk to folks, they don't seem to think that we've hit a point where the human race cannot discover or create new antibiotics. They seem to think that the economics of doing so simply aren't advantageous for the drug companies.
We don't know how long and how likely how long it's going to be and how likely it will be that we'll be able to succeed in making new antibiotics, but we've got to try. There are a few different moves afoot in Congress to make it more economically advantageous for companies to develop new antibiotics. We want to make sure that when new antibiotics come onto the market, they're used well so that companies can both make a good profit, a reasonable profit, and also we don't abuse the medications and lose them in a couple of years. If we don't improve our system for using antibiotics, the new ones are going to be lost just as quickly as we're losing the ones we have today.
There was a study, you probably saw it, that came out of Oregon on Medicaid, but broadly on whether health insurance made you healthy. And what they found is Medicaid worked like normal health insurance. You got the money to go see a doctor, the Medicaid would finance it, you had reasonably good access. But when they looked at things like blood pressure, and cholesterol, things that should have been brought under control within 2 years, they didn't see a huge difference. Our system actually does not reliably translate all that money we're spending on care and on coverage into actual health.
You have to say that having coverage, a way to get care without going broke, is a necessary but not a sufficient condition for a big health improvement. We published an article a few years ago about the Massachusetts experience. Initially, they had a big increase in coverage, but not a big increase in access because they had a gap in primary care availability. And that's fundamentally because we don't pay primary care providers enough. But you also have to look at the time horizon. We need to be able to look 10 or 20 years down the line. If I get your blood pressure down from 160 over 100 down to 130 over 80 with a couple of medications, that's going to substantially reduce your risk of all sorts of problems, but it may take 5, 10, even 20 years for that prevention to happen. But getting the quality and then waiting to see the results is important.
Okay, so I'm the kind of person who literally will not go see a movie about a disease outbreak because it will activate my ancient lineage of neurotic approach to disease. You sit around and you marinate in what appears to me to be the most horrifying data that mankind can produce every day. How does your family live differently? What do you have them do that is different than what most folks do to be protected from whatever you've come to perceive as high risk?
Very little is different. Really, it's basic. Wash your hands regularly. Get regular physical activity. Eat foods you love that are healthy. It's not anything particularly different from what's routine. That's one of the things that's so challenging. Take physical activity as an example. You don't have to have much, 30 minutes a day. And doing that, which can be 3 10-minute walks, is going to make a huge difference in your life. You'll feel better. Even if you don't lose an ounce, you will be much less likely to have high blood pressure, high cholesterol, cancer, arthritis, depression. You'll feel better, you'll sleep better. Doesn't cost a cent. So there's a lot of things that can be done that are not very difficult and can make a really big difference. Of course, get your shots, get vaccinations, get a flu shot every year, and see the doctor regularly. And if you have a problem, make sure to get follow-up.
Do you remember the old Michael Pollan line, eat food, not too much, mostly plants?
Yep.
It kind of sounds like if you were doing that, you would say, eat real food, walk 30 minutes, and wash your hands.
Don't smoke, alcohol in moderation.
But it kind of sounds like, from this conversation, the big stuff you could probably fit into less than 15 words. Compose a sentence for me.
Eat right, get physical activity, don't smoke, alcohol in moderation, spend time with friends.